All right, good afternoon, everyone. Welcome to the Health Literacy at the Point of Care webinar, part of our ongoing VisualDx clinical education series. Today, we have with us Sigriet, Ferrer, and Erin, Keenan, two of our medical research librarians here at VisualDx. They're both part of our editorial team who create the content that you see in VisualDx. And now I'm going to turn the presentation over to Erin.
Thank you, Leslie. All right, I'm going to jump in and get started. So today our presentation is going to focus on the issue of low health literacy in America, and we're going to provide some simple strategies to help clarify verbal, written, and follow-up communications that will hopefully really help improve patient understanding. All right, so just to cover our bases, what is health literacy? Health literacy is the degree to which the individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. And something we want to remember, particularly during this presentation, is that people need to understand this in both English and then the language that they might be native speakers of. All right, so why are we even talking about health literacy? Why does it matter? Well, why it matters is because studies have shown that Americans actually have kind of poor health literacy. More than 1/3, or over 40 million of American adults have trouble reading or acting on health-related information. And this has some pretty dire consequences. So if you want to take a peek at that pie chart on the slide, so that orange piece of pie, that's the proficient level, and those people can understand complex and abstract pieces of health information that are written, and they can act on them. The majority of people end up in that blue intermediate part of the pie, and they can understand moderately complex things, but there are some things that they are going to miss. And then the rest of the circle, basic and below basic, those people understand even less. So what we're finding is that 9 out of 10 people are going to miss something when they go into the doctor's office or when they're reading health-related information. There's just something that they're not going to understand or they're going to misunderstand. All right, and what this really affects is patients' ability to manage their diseases and engage in self-care. It affects how they can share their own information with providers and even how they can find providers and services. And what this means is that it can be lethal, it can affect their health very negatively, and for the healthcare institutions, it wastes a lot of time and money. So now health literacy, we just want to also make it really clear that poor health literacy affects everyone. Like I just mentioned, it's 9 out of 10 people. So it doesn't matter if someone comes in and they're very articulate and they have a master's degree or, a doctor's in something, they can still have poor health literacy skills. And as a little story, a little aside for you guys, we recently did a presentation here at work where we presented a consumer side health literacy class to our coworkers. And even though they rated themselves as advanced or intermediate on their health literacy skills, they actually got a lot out of the very basic information that we presented to them. So it really is everyone, regardless of education level. All right, I'm going to pass it over to Sigriet.
All right, thank you, Erin. So health literacy can be a challenge because it's kind of tricky to communicate to a wide range of health messages to a wide range of different audiences. So we really need to be mindful of different learning styles, cultures, and literacy levels when we're communicating with distinct audiences. Something to keep in mind that's pretty essential is that effective communication begins with recognition that not everyone experiences the world the same way. And another reason why health literacy can be challenging is, or it's becoming more challenging, is because a lot of consumers are finding it more difficult to separate fact from fiction. This applies to being online, and deciphering what information on websites is evidence-based and what isn't. All right, so what can we do about it? So in order to ensure effective verbal communication between patient and healthcare professional, there's a few tips that we have for you. So number one is that you want to summarize the most important information for the patient. You want to ask questions using the words what or how instead of those that can be answered with yes or no. So for example, you can say, what questions do you have instead of do you have any questions? Number two, individuals with limited English language proficiency skills really need to be communicated to in their native language, ideally using words and examples that make the information appropriate and relevant to their culture and values. So this is really what's going to ensure understanding. So oftentimes, family members may be called upon to translate at a doctor's visit, and this can actually create a lot of room for error. So for example, in a scenario where a child is translating to their parent, who's a patient, at a visit, and it would just not be appropriate or useful to have their child translating what the clinician is trying to communicate to the patient, because basically there's a lot of room for confusion and misinterpretation because the child may not fully comprehend the information that's being relayed to them, and obviously they're not a trained professional. So the third tip that we have for you as far as improving verbal communication between patient and healthcare professional is utilizing the teach-back method. So the teach-back technique is actually a method that both healthcare providers and consumers may be able to use to better communicate between each other. So how it works is that the patient receives the health information and is then asked to restate it in their own words, so not just repeat it. And this is done to ensure that the message is understood and remembered.
All right, great. Next is written communication. And what's most important is to just offer patients some sort of written communication, because when it's verbally given to them, they don't always remember it when they leave the office, or they don't always remember it correctly. And this is especially true if they're sick, they don't feel good, something's wrong with them. That's why they're in the office in the first place. So it's very important to write these things down. And the best shortcuts that physicians can use are actually pre-made patient handouts, and these come from a variety of sources. VisualDx has them as well. Or, if applicable, they can also contact their medical library and see what kind of assistance is available. And now I'm going to pass it over to Sigriet to tell you what kind of written communications are best.
All right, thank you, Erin. So we have a few other tips as far as recommendations on ensuring effective written communication. And the first one is you want to tell the patient exactly what actions are vital and explain why they're important, and ideally use plain language. The second thing is that you want to give your patient no more than 3 to 4 main messages per document or section of the document. So just focus on what they need to know. The third thing is keep it short. Use 1 to 2 word syllable words whenever possible and avoid lengthy sentences. If helpful, you can use bullet points, short lists, or numbers just to break up your concepts and make them easier to understand. The fourth thing is that you can use images. Images help clarify the text, they help increase understanding, and in turn, they better help convey the message that you're trying to communicate. The fifth thing is that you want to shape your message to fit different cultures, ethnic groups, or subgroups. As Erin mentioned, you can use bilingual patient handouts, patient information forms, and other written materials as well. All right, so following up. So why do we follow up, or why is it so essential that we follow up with a patient? So following up with a patient at a later date after their appointment is really essential in helping identify possible misunderstandings, answering questions, and or making any possible adjustments to treatment if they're necessary. So at the end of a doctor visit, something to keep in mind that's pretty important is that you want to ensure that the patient knows exactly what's happening next and if there are any action items for them. So some action items can include letting the patient know whether to expect a phone call or if they should go on a patient's portal, for example, for lab results, just making sure that they are aware of what they should do or how to access necessary information. Another action item can be offering a recommendation, a lifestyle modification based on recent diagnoses, or if they need a referral to another specialist.
All right. So what we have up on the screen now is actually the recommended resources for further learning that we've created for viewers of this presentation. And on this page, we have our resources for physicians. So there's a health literacy overview, and there's improving health literacy at the point of care, and that's going to have a lot of strategies and a lot of really in-depth information on how it can be improved at the point of care. And then we've got a couple other highlighted resources. Always check your medical libraries for any assistance that they can offer you. And then some online resources, a really neat translation page where they provide the standard prescription medicine instructions in 5 different languages. And then also a great kind of class on how to write at a really clear and basic level. And then on the next one, we actually have one that we created for patients. This one has basically some really great patient-level, consumer-level health resources that they can find online. So this is something where if the doctor hands them, a patient handout and it says, you have hypotension, this is what's going to happen next. They can take it to the next step and go to Medline Plus and type in hypotension and find out a little bit more about their condition. And there's also a little bit of information on ways that they can improve their own health literacy if that's something that they thought they might be interested in. All right, and we are coming to the end of our presentation today. At this time, if anyone else has any questions or comments for us, to type them in the box.
All right, I do have one question from one of our participants. So the question is, should all staff within a health clinic or office be trained on the subject, or is it limited only to doctors?
Okay, so from what I've read when I was researching, it really should be some sort of training should go out to all staff working within the health office, because there's definitely, room to always provide better patient care, and that's one of the places. So a little story that I read, really sad story actually, while I was researching this, is a young mother who was not a native English speaker. Her infant had jaundice, and her pediatrician told her to come back immediately if the infant worsened at all. And the infant did worsen, so she came back immediately, but she could not communicate to the front desk why she was there before her next appointment. So they misunderstood, and they thought that she just got the date for her next appointment confused. So she went home, and the infant, I believe, actually did pass away after that. So a really strong story for, giving everyone in the office this kind of training. All right. And we've got another question here. All right. Do you think teaching classes and webinars about health literacy at your workplace has changed any of your coworkers' perception of you as librarians?
So I would say yes, definitely. So personally, I feel like it's made us more visible company-wide. I think our coworkers are more comfortable coming to us for assistance with any of their research-related needs.
Yeah.
And just personally and professionally, it just makes us more marketable as librarians. So I would think so.
Yeah, it's cool to share what we actually do with the rest of them.
Absolutely. Mm-hmm. All right, we have another question. Is there an easy way to tell if a patient is not health literate?
So not really, because also patients sometimes are just intimidated by, being in the office, and they do kind of try to hide, and they just agree with the doctor when they tell them what to do, and they kind of pretend to understand sometimes. So it's kind of not easy at all to tell if a patient's not health literate, but then again, 9 out of 10 patients aren't going to understand everything. So it's pretty much good to assume that they might not be understanding something, which is why they want to use something like the teach-back method, why they want to give them a written resource, and why they want to ask questions that are going to result in actual answers of more substance rather than a yes or no answer. All right, I think that we have time for one more. Yes, okay. There's one more here. Okay. how can librarians begin the conversation on poor health literacy with physicians?
So one way to basically start is to kind of expose the problem and offer a simple solution. So basically, you can provide an email survey, you can ask the question, do you know that a third of Americans have trouble reading and acting on health information? Or do you know that such and such library has XYZ materials that can help improve patient understanding? So one really important takeaway, one positive thing to remember here is that even very small changes at point of care can help make a huge difference because the rates of poor health literacy are so high. So anything that you can do to help reduce the low literacy rates will be incredibly beneficial in the long run. So every little bit counts, basically.
Yeah, I agree.
Does anybody have any additional questions? All right, it looks like we're all set. So thank you all so much for coming today. And we will be sending out an email with this handout so that you can use it at your location. Thanks again for joining us and have a great afternoon.
Thank you.
Thank you.